Hello, so this is ethics training for mental health providers. Ethics training is essential for mental health providers, helping you provide the very best help to your clients and patients. As laws, technology, and our understanding of people and the therapeutic relationship continue to evolve, ethics training keeps you and your practice up to date. The theory and study of ethics stretch through every profession as the measure of quality in decision-making. Ethics play a vital role in how therapists and counselors choose to interact with their clients. For mental health providers, having a strong understanding of ethics is important for maintaining healthy boundaries with yourself, other professionals, and clients as you work through some of life's more difficult topics. Keep waiting for a brief explanation of ethics and an examination of how ethics training is important for therapists. So what do we mean by ethics? Ethics is a complex term that we use to talk about several different aspects of appropriate conduct. The most relevant definition of ethics from Merriam-Webster's for our purposes are the discipline dealing with what is good and bad and with moral duty and obligation, and the principles of conduct governing an individual or a group. According to the American Psychology Association, the Ethics Code provides a common set of principles and standards upon which psychologists build their professional and scientific work. Its goals are the welfare and protection of individuals and groups with whom psychologists work, and the education of members, students, and the public regarding ethical standards of the discipline. Ultimately, ethics training ensures that you know the ethical principles that govern psychotherapy and understand how to align your professional conduct with them. Why does ethics support psychotherapy? As mental health providers, you must frequently determine how to apply ethical principles in various contexts. That's why many jurisdictions require psychotherapy practitioners to take continuing education courses in ethics. Through ethics trainings, you'll grow in your understanding of how to weigh ethical issues in psychotherapy and what to do if you get stuck in the decision-making process. Staying up to date with the ethical standards and the best practices will help you to practice psychotherapy in a way that avoids ethical violations. Providers who exhibit unethical behavior can find themselves at risk of losing their license or the ability to practice. Ethics violations may include many different examples of poor decision making. Here's the scoop of the 4 most common therapist ethics violations. So, door relationships. As a therapist, you should never have a client who is or becomes someone you share a personal relationship with. This is actually harder if you're in a smaller town. Breaching confidentiality. Confidentiality is essential for building trust with clients. Sharing private client information with another party without the client's informed consent breaks that trust and violates ethical standards. Confidentiality has a wide scope, including what you tell a friend over coffee and how securely you keep your client files. Failing to end therapy. If you do not end therapy with a client, you are not in the position to help. Whether that's because you cannot give them the attention they need, you do not have the knowledge or expertise to address their concerns, or the client is no longer benefiting from therapy. You are not servicing the client. Practicing without a license. It is unethical to offer psychotherapy without the credentials, such as a license or certification, that are required in the jurisdiction where you're practicing. Licensing boards are a great place to start. It's each therapist's responsibility to know the requirements that govern their practice and follow them. Impacts of unethical behavioral. Ethics training for mental health providers can help you avoid unethical behavior. This is crucial as therapists' ethical violations can have a lasting impact on you and your clients. For someone who has come to you for help or attention to address issues and problems, areas in their life, unethical behaviors can be damaging to their progress. Because of their inherent imbalance of power in the therapeutic relationship, clients are vulnerable. Your unethical choices can harm a client's ability to trust, both in future therapy context and in their personal lives, and can cause them further psychological damage. Ethics training keeps you in the loop about how to act ethically and protect the integrity of the therapeutic relationship, ensuring your client is safe and supported. Staying compliant. While most mental health professionals took ethics courses in school and during their certification, it is important to refresh your knowledge and stay on topic of new developments in ethical psychotherapy. Continuing education courses on ethics can be a fantastic way to stay fresh on the topic and stay up to date. Many jurisdictions require a minimum number of continuing education hours to be about ethics, and it's easy to see why.